I'm Jeff Cornwall, and this is the Entrepreneurial Mind. Today our guest is David Condra with Amplion. We'll be back to talk with David after this word from our sponsor.
If you want to feel the wind blowing through your hair and see the great city of Nashville at the same time, check out Nashville Scooter Tours. Trekking through the downtown streets to Music Row with Nashville Scooter Tours is safe, eco-friendly, and a whole lot of fun. They use Xenon electric scooters that go 55 miles on a single charge. Find out more by calling 615-290-5563 or book your reservation today at NashvilleScooterTours.com.
Welcome back. David, let's talk about the future of healthcare in terms of patient care. You guys have come up with an amazing technology, and explain kind of how it works.
Absolutely. Thanks, Jeff. My favorite topic, by the way. Appreciate your leading off with that. Amplion Alert is the product that we deliver today in the hospital environment. And we basically go into the patient room with a proprietary device. It's a computer-based device. We mount it on the head wall and in the patient room, and we detect patient care needs, whether they be devices that are alarming in the room that today are most often only beeping and expecting people to hear and respond.
Which they often don't.
There is an entire topic called alarm fatigue today,
right,
which is actually only recently recognized by the Joint Commission as a significant health hazard, and that is that nurses can become desensitized and do become desensitized to the massive numbers of alarms and alerts. If you think as a layman walking on the floor of a hospital unit that all these sounds must be overwhelming, you can imagine working in that environment all the time.
And they don't know if it's just the patient wants a little drink of water or they're in distress.
It's very difficult to determine what the level of need is and even where it's coming from. You know, if you think about a hallway, you've got doors entering the hallway, you hear a beep down there somewhere.
Right.
Which room is that? Which means which patient is it? Which means whose nurse is it? Which means what device are they actually on? And how urgent is that particular need? And
so
many people assume that all of those are connected to some central monitoring station, but they aren't.
So all of the information that's available for a patient, if I'm in the hospital and I'm in a bed, all my vitals, all the devices they have me hooked up to, they all feed into your device?
We have the ability to monitor those and determine when any of them reach an alarm condition.
That's a lot of different interfaces.
It is, and that's a big part of what we've had to develop is the ability to essentially be able to connect to a wide range of devices. We also learned, and this actually was generated by work we were doing in communications in hospitals with wireless technology for nursing care, and nurse phones and nurse messaging. And we came to understand all of these types of events that are occurring that no one has any hard data on or ability to track and respond to. But while we were in that process, we began to understand the nurse's challenge, which is in many cases overwhelming with a number of timed events that they should be doing. Some patients cannot move themselves in bed.
Right.
They're at risk for bed sores.
For bed sores.
They need to be turned every 2 hours.
Right.
Well, there's really no easy system. Nurses have to keep up with that in their own individual set of notes. I've seen everything from on the hand to on various notepads just to know when did I last turn Mr. Jones in 102.
So all this feeds in, and then it feeds, where does it go from there?
We take that to our server, and we know in the server every caregiver, every nurse assistant tech, respiratory therapist that is assigned in that hospital. We know what rooms and what patients they're assigned to. We know what devices they're carrying. What wireless device does that nurse carry? And we know that type of alarm, the first time we hear it, we send it to the assigned nurse for that room. We wait a defined period, which the clinical leadership specifies.
Right.
If it has not cleared, then we send it to someone else. And while that's occurring, we're actually tracking it on a live status monitor in every unit as well as an individual monitor at the nurse's station that lets anyone involved understand we have these 8 active alerts going on right now, and here's their status. Here's who has them, here's who's accepted them, here's how long they've been going on, and here are the other people who have been notified, all of which is actually brand new concept in healthcare. Believe it or not, that has not occurred before in healthcare.
And the ripples of what you're doing, I mean, they go into accreditation issues, they go into measuring hospital quality and
Sure.
risk management. Sure. And
we have data that no one can get today.
Right.
Because all the types of events and tasks that I'm talking about today are not captured. They happen in essentially open space and open air because they're all responded to orally or actively, but we know when that device, we know what it was, we know when it went off, we know what patient's room it is, we know who we told about it, we know who else we told about it, we know when they accepted, we know when they actually went in the room, and we know when it stopped. So with all that data, we can actually help hospitals make changes in their processes and procedures and in real time measure what effect did that have.
So even some of the movement towards more lean processes in hospitals
Absolutely.
can benefit from that data.
Any
Right.
process improvement depends on the ability to measure.
Have good data.
And if you can't measure it, and many times of course today they can measure outcomes. They know how many bed sores they had in a quarter.
Right.
They know how many falls they had in a quarter.
But that's already happened.
But it's
That's-
way back.
That's in the rearview mirror at that point.
And how could you possibly, in any meaningful way, have a control and a variable in that kind of environment? You know, you just can't.
So, having been in the healthcare industry for quite a while, in a past life, healthcare professionals are sometimes a little resistant to
Certainly.
this kind of active monitoring and different kind of technology. How are you winning over their acceptance into this technology?
Certainly, healthcare, as in most professions, in most fields, has evolved over time and have developed a standard of practice and normal care processes. At the end of the day, though, we find the nurses are very, very interested in improved patient safety and improved quality of care. I mean, they are there because they want those patients to get better. And the last thing they want is for that patient to see harm on their shift.
And it sounds like in some ways this makes their job easier.
It's an amazing load lifter. And
Right.
I'll say that because if you can imagine, they were having to carry all of this in their mind. Imagine
Right.
you're a nurse on a floor and you're expected. We had, in 1 week, we had measured 4,500 sounds that occurred on one floor in the course of a week. And if you're a nurse on that floor, you're expected to filter in the background because you're doing your job.
Right.
You're out there taking care. You're supposed to constantly be measuring in the background. What is that? Am I supposed to deal with that? Has anybody got that? So we lift that by giving them the specifics. If it's something they need to know, they'll know it. If it's their patient, they'll know it. If someone else hasn't gotten their patient, they'll know it. If that patient needs to be turned, they don't ever have to think about that again.
Right.
We'll let them know that it's been 2 hours. So that relieves, if you can imagine, texting and driving is a big problem these days.
Right.
Because our mind really can only properly focus on just so many things. So imagine yourself as a care deliverer with all these layers. If you can relieve some of those layers, you'll improve their ability to deliver the critical care to the patients that they care about. So yes, there's a resistance to changing my daily behavior, but as soon as they understand this is making a difference for me and my ability to deliver care to my patients and all the patients on my unit, because as a team, we can all see when one of our partners gets behind.
Right.
We can see a backlog on a screen. We didn't know that before.
Right.
They were all working in silos. So now we have a team-based, status-oriented display that helps all of us understand who needs help.
And how's the rollout of this going? Is it
Incredible.
Yeah.
It really is. The most significant, I guess, tool for us is when someone walks onto the floor of one of our hospitals, an experienced healthcare professional. Nurse managers are probably the most common. And all of a sudden, the question is, why have I never seen this before?
Wow.
Why has no one ever done this? Because they can stand there and they're very familiar with the normal way a unit works. And they can hear an alarm, watch it appear on the screen, see a name pop up next to it that Sally has that message, see Sally hit accept, which means I will go take care of that, watch it until Sally goes down, enters the room, takes care of the alarming device, which clears it from the screen. And instantly, it's like, why would we not have ever done that?
It's a real game changer in terms of patient care,
It
and that's
really
pretty
is.
exciting.
Yeah. It
Congratulations
really
on all
is.
this, and thanks for coming and joining us
Well,
today,
it's a
David.
pleasure, anytime.
All right.